Hey, this is Dr. Waldron, and good afternoon. Welcome to our Healthy Cocktail Hour. Today we're going to be going through a Florida blueberry smoothie, so it's exciting. But before I do that, I want to wish everybody a happy Easter. He is risen, and this celebration of our Son, Lord and Jesus Christ. So I hope you guys have a great weekend. Keep it healthy, and hopefully some things we can share with you today will continue to help you build your health and your knowledge, your wisdom about what you need to do in the time of a pandemic. And there's a verse I want to share with you starting out here today. It's Psalms 139:14. It says, I praise you because I am fearfully and wonderfully made. Your works are wonderful. I know that full well. And I'm always reminded about that, just kind of as a Christian, how we live our lives. And just sometimes we get so caught up with what's going on out in the world today, and especially with this pandemic, and that we need to be taking this very seriously. But you know what? God has done a phenomenal job with us and what He has done for us in our health and our well-being. And that is something I just really continue to try to build on in my practice, and for my patients, or my family, for our community, is really focusing on making sure we take great care of ourselves, physically, mentally, and emotionally, and spiritually. So happy Easter to everyone out there. Today we've got a Fresh from Florida. We are affiliated with Fresh from Florida, and our focus is really, I take care of a lot of ranchers and farmers that produce a lot of great products that are fresh from Florida here. Today we're talking about a blueberry smoothie that can really, you look at the health benefits of blueberries, it's phenomenal. I think a smoothie is a great way for all of us. I start my mornings oftentimes with a smoothie. It is power packed with everything from protein, fresh from Florida, blueberries and strawberries, and a combination of maybe some protein. We also put a scoop of greens in it. There's a variation of things you can put in that smoothie. Make it healthy, make it yours. This is a good baseline. This comes from the Fresh from Florida recipe book, so to speak. But we have got a couple of things, Shannon, on our blueberries too, as far as adding those. But today we're going to start out in a base of our smoothie. And again, you can do this can be a pre-workout. This can be a post-workout. I like to do it in the mornings, so I make sure I get just a lot of good nutrition to get the day started out with. I've also done a few things where I actually put a scoop of the PRP, which is a polypeptide mix that is good for the immune system. So I've been doing that since November, just because it was winter, and I usually take some form of an immune booster anyway. So it just really worked out for me that I implemented that in November. I feel like my immune system is as strong as I could possibly be at this point in time, no matter what it comes in contact with. So when we look at the blueberry smoothie today, you're going to have yogurt. We've got milk. And we've got some lemon juice. And guys, the recipe will be on the Facebook notes there. We've also got chia seeds, which is going to add some extra fiber in there. Protein, you can put protein powder in there, which I'm going to put it in this one. It makes it a little bit smoother, and I just like the balance of the protein with the carbohydrates. Of course, I put the yogurt in. We're going to put half of a banana in, so I'm not going to break that down. I'll let my helpers do that. And then we've got our Fresh from Florida blueberries. You're going to dump those in. And again, you can put a various number of other things in this to really boost the nutritional content. And that's really what you want to focus on, is good nutrition, putting better nutrition in your body. You moms out there, this is something to me, I would tell you, get in the habit of doing it for your kids. You can create such a variation of good quality nutrients in a smoothie. You may have to make some adjustments, and making a smoothie is something that really takes practice. So you're not going to do it perfect the first time, but once you do it repetitively, you're going to find you get better and better. We use blueberries, we use strawberries, we use pineapple, we use a various number of different fruits. We balance it with some protein, so I do like to add the protein so it slows down the sugar impact on the body, even with the natural sugars as far as that goes. We use a lot of greens type products, and I know a lot of patients are out there that use these type of products as well, just to really give you better nutrition, all in a smoothie in a matter of 4 or 5, 6 ounces. Just a great habit to get into. So again, that's the Florida blueberry smoothie, fresh from Florida. Blueberries, and of course, guys, you've also got a lot of the watermelon growers right now are preparing and getting things ready. These guys, I know there's some coming out of South Florida. We should be in our Central Florida area right now, getting ready to depict. So I'm excited to see some fresh watermelons in the grocery store soon. I love watermelon. It's got a phenomenal amount of nutrition that when you go online and look at how much nutrition's in a watermelon, just a phenomenal product to consume, and get in a routine where you don't just go buy one. Get in a routine while it's fresh. While the season's on, to eat watermelon here in the spring and through the summer, as far as that goes. So we're We're going to have the smoothie made and mixed up there, and we'll have that back in a little while. And we're going to go on today. I've got a topic that really that we deal with every day, and in practice over 30 years, I look at something it's a daily occurrence, and it affects everyone out there in our community in some form or fashion. Maybe yourself, maybe your family. You know someone that is dealing with those type of issues there. And you know, when we look at lower back pain, and that's what I'm going to refer to here today, I'm going to have to slip that over there. I need a little help right there. Got it. But today we're going to talk about low back pain. And low back pain is something that I see so many patients with on a daily basis. Some of them are acute, many of them are chronic. It's a condition that really plagues a lot of folks, reduces their ability to work. It's one of the number one disabilities, is the the spinal disability in this country. So more people lose the ability to work and function like they normally should because of low back pain. This last week, we saw multiple patients with acute low back pain, some of them in traumatic situations like a car accident, just tremendous to watch a normal functioning person go from feeling like they're 100% down to not even being able to get up and walk or even sit on the commode or just do the basics on a day-to-day basis. So I really want to focus on low back pain. We have a new website that you can go to. It's called sebringdisccenter.com. And folks, the number one pain producer with the lower back is the disc. So we're going to talk a little bit about the disc today and what you can do for it. Many patients will deal with degenerative disc. If you've had an MRI, you may see that you've had a bulge disc or a herniated disc, even what's called an extruded disc. And we're going to talk about that a little bit. These positive MRI findings, of course, run through a second opinion where a medical physician will read that MRI and look at the details of what's going on with the disc, how it's broken down, how the degenerative changes are affecting the joints in the lower back. There's a lot of details to the lower back. So I just want to, when we look at lower back pain, the causative factors, the degeneration of the disc, which is going to take the vertebrae and narrow them, where they encroach upon the nerve. So sometimes you end up with encroachment, or the term that many of you know or are familiar with is stenosis. So spinal stenosis is something that as we get older, it's somewhat anticipated we're going to have stenosis. But if we learn to take better care of the spine, and even in the midst of being 30 and 40, 50 and 60, that even with degenerative disc and bulge disc, where these discs have broken down and a little bit more wear and tear, is, you look and see, those kind of things make a big impact. I want to say hi to Kara. I see you're tuning in, Kara. Hopefully you learned some good things here today. But as we look at these disc issues, and herniated disc, of course, is one that becomes very significant. And we deal with a lot of those just with general chiropractic care because we restore mobility to a spine that has lost motion. And you want to maintain motion in the lower back or in the rest of the spine in order to get up and do the things you want to do every day. You can lose mobility and not have pain. So that's something that a lot of times patients will realize, hey James, I see you're tuning in today too. Thanks for tuning in. When we look at the lower back and you look at the changes in the dynamics of the lower back, we can be pain-free and still not functioning properly. And that's what I tell patients. Structure dictates function. Over time, we lose movement in the spine. A lot of times things begin to degenerate before we ever have any pain. It's a lot like the heart. You can have heart function, you're doing well, but you've got blockage that's 50, 60, 70, 80% blockage before maybe you end up with a heart attack or some type of a vascular event. So you're not always going to be notified. It's kind of like driving your car. The red light doesn't always come on until maybe it's almost too late, and you better pull over immediately and do something immediately. And a lot of times patients just keep going. The red light has come on, you've had pain or discomfort or stiffness or restriction, and we put it off as the fact that we work hard and we did something particular, made us sore, and we keep moving forward, and we're only adding to the insult of the lower back. So when we look at this, when we look at these diagnoses, oftentimes, hey Kat, good afternoon. Glad you're joining with us. When we look at these are most commonly diagnosed with medical physicians. We use neuroradiologists to read our MRIs. I prefer that. I think their eye to detail is much greater. So we have set up over the years, as we see these MRIs, there are some differing opinions and different reads on them by the radiologist. So we like to have a radiologist that gives a good read, knows the details of the disc, and can really indicate what is going on, whether it be degenerative, whether it be a bulge disc, a herniated disc, an extruded disc, which even goes beyond a herniation. We work with several different neurosurgeons over the years. I will find that the neurosurgeons over the last 5, 6, 7 years have really been much more supportive of what I'm going to share with you here today in regards to more conservative care. The outcomes of low back surgery are just not what people expect. We see so many patients with a failed back syndrome in our office, and my colleagues, I mean, we deal with this every single day. We see more of these cases than probably any other type of practitioner, with the fact that people are just trying to regain function and get back on their feet out there. But these changes in the lower back, patients oftentimes will end up at a neurosurgeon. In recent weeks, I've even had patients in here where the neurosurgeon said, listen, if we end up doing surgery, we'll do the first one, but chances are you'll be back here in the next couple of years and do a second one. And we have many patients that will end up with a third low back surgery because of the changes in the disc and what's going on there. I kind of mentioned this down here. You go for a first surgery, a second, a third, and eventually people end up with disabilities. And for no doubt, many patients, even after the first surgery, will find that their limitations on their abilities to function are phenomenal. So it's something we can do a lot for before you ever get to this level, to a first surgery, or even for that matter, even a second or third. We do have a lot of patients who will have a back surgery, will come in, that we're able to provide chiropractic care, restore mobility, show them proper stretches and exercises, but we also will provide spinal decompression in the form of non-surgical spinal decompression. Because understand, when you see the neurosurgeon, and a neurosurgeon does spinal decompression, he does it surgically. So our goal is to keep you from the surgical situation. If we can come in here and provide non-surgical spinal decompression, if you'll go to sebringdisccenter.com, we have some great explanation of how that works, how it affects the disc, and how we treat patients. But it's a great website that we have that's got a lot of great information. Definitely write that down, make note of it, come back and check it out, and get a little bit more detail than what I'm going to share with you today. But non-surgical spinal decompression is a treatment that we have been providing in this office for almost 20 years. We're the only chiropractic physician in the county that provides non-surgical spinal decompression with the technology that has been researched. So when you look at research, and you go look at the research information by Harvard and Yale researchers, some of the top medical researchers in the world, that research was done on one particular company that provides a technique and a type of technology that we utilize in our office, and we've been using that technology for almost 20 years now. There's a lot of decompression tables out there that use other technology that is not based on the researched information. So I say that because it's quite dynamic as far as the technology that we have in our facility and the machine that we have and how it works. So I guess what I'm saying is that they're not all created equally. And the technology we have, though, you're looking at outcomes typically in the research. If you go online, if you go to our Sebring Disc Centers, you look at the reference research, you're looking at typical outcomes on those research articles of being well over 90%. I will tell you that in our clinic in 20 years, our success rate is well over 90% for patients coming in the door with degenerative disc, bulge disc, herniated disc, patients who have been to the neurosurgeon who's been recommended to have back surgery, who choose an alternative route to look and say, hey, can I avoid that surgery? So that's what a lot of times they would come in. I deal with a neurosurgeon out of Winter Haven. He oftentimes will give the patient the option, go back and see Dr. Waldron and consider spinal decompression. He's trying to give that patient every option and every ability to improve the health of that lower back before he looks at the idea of going in there for that first surgery. And really unique that I've had 3 different neurosurgeons tell 3 different patients in the last month that when they go in and do the first surgery, the likelihood is they're going to have to do a second surgery within the first couple of years, and possibly a third surgery if things didn't work out as well as they would expect. Surgery in general does not have a great outcome, not even close. It does not compare to what we can do with spinal decompression with a statistical outcome of greater than 90%. Folks, the key is to rehabilitate the lower back. You can do it through spinal decompression. We see a lot of those patients that we also provide chiropractic adjustments to help restore movement back to the facet joints and help reestablish function in the lower back. But spinal decompression is a unique treatment that helps to rehabilitate the disc. We can put patients back on their feet. It makes me think of a rancher that I took care of not too long ago who came in the door and really said he didn't think he'd be able to ride his horse again, didn't think he'd be able to get back in the cow pens and work cows. We put him through 20 sessions of decompression. He is back on his horse. He's back in the cow pens. He's living a somewhat normal life, where compared before, right out of his own mouth, was the fact that he did not feel that he was going to be able to get back on his horse. So quality of life, reassurance, rehabilitating that lower back. You do not have to suffer with taking a bunch of pills and shots. Pain management, it is an option. But I look and go, listen, I had one of the best pain management physicians that worked in my practice probably 7-8 years ago. He lives in Jacksonville, Florida. He's been practicing over 25 years. He told me ultimately pain management is a Band-Aid. You're not doing anything to fix the lower back. You have low back pain, you've got problems, you've got issues with disc. You're not changing those discs. You're maybe, if you're lucky and you hit the right spot, you may get some relief, but typically it's going to be temporary. So when we look at this, we're trying to really help rehabilitate. The research is indicating that not only are we rehabilitating these discs, we're even looking at the fact that we do a pre-MRI, and after 90 days of care, that we come back and do a post-MRI and show the difference in the amount of herniation that the patient may have, or even the amount of extrusion. Those are now measured. Our neuroradiologist measures those by the millimeter. So we know if you've got a 6 millimeter herniation and we go in and do decompression, we come back in 90 days, if a patient prefers, to have a post-MRI done and to see what kind of success we've had in reducing that herniation. Number one, they're asymptomatic. Oftentimes they feel functionally much better, but it's even nice to know that that disc has been rehabilitated. It is less, maybe gone from 6 millimeters to 2, so 50, 60, 70% improvement in the amount of actual herniation. Oftentimes you'll see a herniation that has resolved where the disc is actually healed up. So you're seeing a lot of great studies out there with a very conservative approach to lower back issues. And the biggest issue we see a lot of are failed back syndrome, and we do see a lot of patients who have had back surgery, and they have come in, many of them for the second, and I've had quite a few patients who have had 3 low back surgeries. So we understand, we deal with this every single day, the acute low back, the chronic low back. It is very difficult when these low backs get worse as time goes on. So the key is the sooner you take care of it, the better. The more and longer you go, the more wear and tear you create on the lower back, the facet joints, the disc, of course, and the changes just from an osteoarthritic change get progressively worse. So guys, don't wait. I know that there are a lot of people out there, when they listen to this, the review of what we're talking about there, or even if they come in for a consultation, there's no charge. We'll sit down with you, discuss your issue, discuss your MRI, review that with you, give you a second opinion on a more conservative basis, where we're not looking at surgery, we're looking at helping you rehabilitate through spinal decompression. I've got lots of great research information here in the office. If you need any of that kind of information, listen, the better educated you are, the better informed you are. Look at the statistics of the research, folks. Surgery does not, and I'm not putting it down, there's a place and a time for surgery. Just understand the outcome of low back surgery is not good. It's a really difficult area of the spine to work with. It makes it very difficult to work with as far as that goes. So stay with that, try to focus on doing the more conservative route before you get aggressive. One thing about it, you can't take the surgery back. Once you've had it, you're going to deal with those consequences, whether it be further stenosis or perineural fibrosis, the different changes that can continue to take place in the lower back. Oftentimes, when they do spinal decompression surgically, they will take the bone, they'll do a laminectomy and take the bone off, but you still have the same arthritic and degenerative facets. There's not much movement there. The dynamics are not very good. So that's where a lot of times chiropractic, the adjustments as we restore mobility back to the spine, patient feels better, they function better. That resolves a lot of these issues with these backs, even with the herniated backs. But it's that case that is just not getting better. You've been to the chiropractor, you've had some physical therapy, you've done a variation of things, maybe even pain management, maybe you've even been to the neurosurgeon for a consult. Then spinal decompression is an option you definitely need to take a look into, become more educated and informed. We provide it here in our office. We do it every single day. We have a tremendous number of patients that utilize spinal decompression with great success. I had a mom, I got to tell you a quick story. She came in, she had been going locally for some pain management, paying out of her pocket cash. She just was at her wit's end. I could not believe the extent of pain she was in the day she came in, and I'd seen her in the past for some general chiropractic care. So anyway, we put her on some spinal decompression. Within about 6 sessions, this patient was walking in totally asymptomatic, doing some things with her kids that she had not done with for months. And the fundamental basics were we put her through about 15 sessions of spinal decompression. She's been back on her feet, asymptomatic, functioning, what she would call well within normal. And we just really try to educate and continue to do some general maintenance type care to help her keep a stronger, healthier back. So understand these things happen even in younger patients. You do not have to be 40, 50, 60, 70, 80 plus years of age. You can easily be in their 20s, 30s. I've had some recent patients in the 20s. Guys, you folks in the 20s, you're spending more time on computers and cell phones than any of the other generations have. I've got patients that are 26 and 7 walking in the door with bulged disc, even herniated disc. And so spinal decompression is a great conservative treatment that keeps you out of even the neurosurgeon's office, because there's really no need to. In most cases, we can manage those cases on a conservative basis. which is exciting. It keeps you out of the way of the pain management with the injections. And you look at some of the statistics, even the FDA looks and says from the standpoint of pain management that spinal or ESIs into the spine are not even recommended as an FDA type approved procedure. So a lot of those are done in the searches of trying to calm the pain down, but I'm telling you the success rate of it is just not that great. You're not taking care of the mechanical issue. You got to take care of the mechanics to restore movement and function and help that patient get back on their feet. That's a lot of information I know on the lower back. It's something we do every single day. If you've got a low back problem, you've got a low back condition, you've had an MRI, you've got a bulged disc, you've got a herniated disc, you've got degenerative disc, you have stenosis. Those issues, call our office and sit down and let's do a consultation and let's just see what the potential is that we can help you with that type of condition. We have great success. I've been doing this for over 30 years. We have got a lot of great technique and success with what we do. And our goal is to keep you out of the medications. I'm going to reference, the opioid epidemic. You look at what's going on in this country right now, and the pandemic has totally obscured what was going on and what was such a big issue. And those people are still out there. That has not gone away. I just saw a billboard ad, and I saw one on TV talking about the opioid epidemic and the issues that these people have continued to deal with, the patients dying from opioids that a lot of times start with simple low back pain and walking into a doctor's office and getting a prescription that goes on and leads into harder, more intense medications that ends up being an addiction process. So low back pain, nothing simple about it. It is phenomenal if you've ever had it. It's the worst pain you'll ever experience, in my opinion. And I see patients every day, both men and women, who will emphasize the fact that it's the worst pain ever. So something to keep in mind. Give our office a call. Our number, 863-382-4445. Give our office a call, set up a consultation, come in, sit down, let's talk about the lower back issue. Some other things I want to share with you and talk about a little bit today is just where are we at on the basis of health as a whole. We look at health when we come in here as adults. We're trying to do the right things. We've talked about eating more whole foods and taking your supplements, drinking plenty of water, exercising. Those are the things that adults need to do in order to manage good health, good homeostasis. If you do not do those things, we lose the potential for health. And as time goes on, we even deal with issues like obesity. And I'm going to talk about obesity briefly here, but next week we're going to talk about obesity in much more in-depthness about what you can do for it. We have a weight loss program in our office that is phenomenal. For 8 years in a row, we've been voted the #1 weight loss facility in this county. And I just look and go, our goal with obesity is to help patients lose the weight and live a more productive lifestyle. For many patients that are obese, guess what's one of the biggest issues they deal with? It's low back pain. You increase your weight 20, 30, 40 pounds, not only are you decreasing your overall health and putting yourself in a state of dis-ease or eventually disease, obesity is tremendously stressful on the lumbar disc. And when we do become obese, the change in the physiology is not as great as it once was. So we don't heal and we don't we don't mend and repair as well. So when we look at the disc itself, this is just kind of a picture of the disc. We have a nucleus in the middle. We have what's called annular fibers that go around the disc. And so it happens over a period of time because of compression and of course all the things we do before the age of 20, the bumps, the dings, the bangs, the car accidents, playing football, baseball, golf, you name it, all these different activities that we do, work, sitting, the amount of compression and sitting. Today we talk about sitting being the new smoking because we do so much sitting today, especially with computers and the technology that we're around, and also the cell phones. Of course, sitting on our behinds with these cell phones is killing our necks and our backs. But the bottom line, there's a healthy disc here that we should all start out with, even as kids. And the key is taking care of these parts. Structure dictates function. So the goal is we want to maintain a healthy disc. And what happens here, and what happens is the breakdown of the nucleus and mainly the annular fibers. These fibers break down, and so that disc will migrate out to the edge and ends up being what's referred to as a disc bulge, or eventually a herniation that actually irritates that nerve, and oftentimes we refer to that as sciatic pain or leg pain or radiculopathy or radiculitis. But the bottom line is that nucleus has migrated out towards the edge because of the breakdown of these fibers, that those fibers create a bulge, then possibly a herniation, then eventually even an extrusion that affects the nerve root and is going to cause pain. Now granted, this doesn't happen and not have pain. You don't have to necessarily hit the nerve root. You may just have low back pain and no leg pain. But understand the outer third of these annular fibers are innervated neurologically. So with the neurological innervation there, when things are damaged, you have what's called cytokines that are released, or a cytokine storm. And that storm of chemicals affects the nociceptors, and that is what generates pain. And of course, those nociceptors go to the spinal cord and then go to the brain, and your perception of pain is actually in the brain. We think the pain is in our back, but we perceive it actually in our brain. So that is the dynamics of the disc. That's what happens when you've got nice set of parts there, and over time we do the things that we do. But we tell individuals, get up, you can keep doing it, you're fine. And we don't address the issues. I look at cars. We take our cars and we take it for a periodic checkup. We rotate the tires, we change the oil, we do things to maintain that car so it lasts longer. Guys, there's no difference with this lower back and with our spine. You know, chiropractic is the #1 spinal care as far as maintaining care. My focus is not so much on taking care of back problems as much as it is helping people maintain a good, healthy, strong spine. So keep that concept #1 in your mind as far as what do I do to maintain good health, good posture, maintain good structure, which is going to relate in better overall function. But when these discs do break down, we end up with these bulges, these herniations, these extrusions, they can change our life all the way to the point of eventually having a disability. So our goal is to help patients, build more towards this direction. If we are obese, we help patients come in, lose 20, 30, 40, 50, 80, 100 pounds or more, and we take that weight off. We are going to move this patient back towards health. Many of these patients will end up with heart disease. We've got patients with cancer. They're in a state of disease. They don't feel good. They're not functioning well. So as we move in this direction, we're losing the potential. And again, when you are obese, we're eating a diet that is more pro-inflammatory. Inflammation is the push to affect the actual immune system. So you begin to affect the immune system. And when we talk about compromised immune systems, listen, health is up here at 100%, and your immune system is doing its job, and you're doing all the right things, proper fruits, veggies, quality proteins, all the right things to put in the body. But when we don't eat well and we become obese, we increase the amount of inflammation in the body. The immune system becomes overworked, and we really affect our overall well-being as we keep moving in the direction of disease. Guys, it's just a process. It doesn't happen overnight. The only thing that really makes a big change is when people get traumatized. So if you're in a car accident, sure, you can damage the disc, create all kinds of cytokine storms, inflammation, and pain, which can lead to eventually disabilities. But the bottom line is what we try to focus on in this office is if a person comes in that is obese, I'm dealing with a patient right now, and there's a couple different options on the table. So our goal #1 is to help the patient lose about 25 or 30 pounds. They have had a failed back surgery, so we're going to look at going in and doing some lower back work with non-surgical spinal decompression to help that patient move back in the direction of health and well-being. So I know I've covered a lot of things there, but again, when we look at health and 100%, we begin to lose that as time goes on, some of that being with the aging process, but at the same time, things like obesity, which leads to over 35 different disease processes, many of those cancer, heart disease, diabetes. Listen, folks, you're talking about a compromised immune system. If you're dealing with obesity or you're overweight, the likelihood of your immune system working up to par is not good. So you look at what you're doing when you're going to the grocery store, and I emphasize this to my patients this week. Go to the fruits and vegetables section. Eat more of the whole foods. Get those nutrients back in your system. Try to supply your body with the nutrients. We are so concerned, and please understand, I understand the COVID-19, I understand our concern. Our #1 concern should be taking the proper steps to try to avoid transferring it in any way. But #2, you got to take care of you. And when we go to the grocery store and we're choosing all these foods that are not going to help benefit the immune system, make some changes. Go get some of the veggies. Add more veggies to your diet. I have for 30 years been taking care of patients, and I'll tell you, the majority of patients that walk in the door don't take their supplements on a routine basis. They're not disciplined about it routinely. Most don't drink much water. So it's one of those that we coach our patients into drinking more water consistently, taking their vitamins every single day, not once a week, not twice a week, every single day. Now all of a sudden I got patients walking to the door, they're taking vitamin C every day, they're taking their multi every day. All of a sudden they're paying attention because of the fear of this pandemic. I'm gonna step back and tell you, step #2, take better care of yourself. Take your supplements, take them every day just like it was your medication. Granted, I got high blood pressure patients and I kid with them sometime. I'll ask them if they've taken their vitamins. They tell me, hey, yeah, I remember to take them maybe once a week. I ask them if they take their blood pressure medication. They go, oh, absolutely every day. My point to them sometimes, I'll say, hey, why don't you just take 3 or 4 days off from taking the blood pressure medication, see how you do. I'm just kidding with them. But my point to them is this. The look on their face and their response is like, hey, are you crazy, doc? the point about it is make your nutrition and your supplements as vital to you as any medication. Take those consistently and build your health, and maybe you see some of those medications decline if your doctor chooses to take you off of some of those. We see a lot of these patients with obesity. We put them on a weight loss program. They lose 20, 30 pounds, not uncommon to get off their high blood pressure medication. We even have insulin diabetics that will get off their insulin and then off of their oral medication. In that case, we've helped them reverse the diabetes. You can make some phenomenal changes just by eliminating certain foods and eating quality foods, moving yourself back in the direction of health, especially if you're down here at 40, 50, 60%, moving you back towards the 80, 85, 90%. I'm not going to tell you you're going to be 100%. Maybe age is a factor. Maybe that's going to have an impact. We just got to try harder to maintain our health at a higher level. So a little bit of a description on disease, and I think that comes together with what we've been dealing with as far as our immune system, what we're trying to do to build a stronger, healthier immune system. We talked about it last week. I'm going to tell you still again today, learn to take better care of yourself. Eat quality foods. Go to the grocery store today and don't go look at the bagged products or the sodas or the diet sodas, those kind of things. Quality, the fresh from Florida, the blueberries, the strawberries, the watermelons. Eat those foods. Granted, I know that to me today, strawberries and the different fruits and berries are almost like my dessert. Then we focus on good quality vegetables, good quality proteins, the meats. If you're a meat eater, if you're a vegan, then you address those issues based on what you normally have on those days as well. So stop and just take a little bit better look. Moms, I know it can be tough. Kids don't want to eat. They can be picky. Keep presenting them the good foods. They will learn. It will take time, and when you give them the options, it increases. Maybe it is putting us a blueberry smoothie together. They don't even have to know. You throw the blueberries in there, and maybe you throw a couple of leaves of spinach in there, but you just tell them, hey, here's a healthy drink, try it. So a lot of times they'll try it, they like it, and the next thing you know, you're able to really put some great nutrition in the course of a smoothie to benefit their health, as opposed to drinking a soda or maybe something out of a bag, maybe some chips or that kind of thing. Begin to build better nutrition in these kids. Again, I'm going to emphasize the fact that we are dealing with more kids with obesity that are also dealing with non-alcoholic fatty livers. Those issues are horrendous in this country. So you got to understand, we've got to make some hard decisions as parents to stop and tell our kids, no, you're not eating this. We're not going to consume that. Quit buying it. Don't bring it into the home. Give them more whole fruits and veggies, quality foods, and build a quality kid, or at least a quality health for that kid. They deserve that. Listen, I grew up in a time frame that we ate breakfast, lunch, and dinner. We didn't eat snacks in between. We didn't drink no 48 or 54 ounce diet soda or any type of a soda of that amount. If we had a soda, it might have been 6 ounces. It's a treat, and that's exactly what it is, but it's a high sugar, high refined carbohydrate that supplies calories but no nutritional value. Fuel your body to heal and be healthy. Even you guys with back issues, and the low back issue that we talked about, low back pain, listen, it's a pro-inflammatory component. Most diets are poor, in regards to the patients I see that have a back issue. And oftentimes it is a weight issue that's also complicating that. And next week, again, I'm going to talk a little bit more about obesity and some of the statistics on there, and just making you more aware and educated about what's going on. And there are some solutions out there. And we focus on nutrition first. If a patient needs something more aggressive there, that's always an option. But listen, take care of the fundamentals. Part of that is retraining and coaching. And in our practice, we do that every single day. I think you can go online, you look at the reviews of the patients that we help and see really transform their entire life. I mean, I'm telling you, going from being 50, 60, 70 pounds overweight, being 100 pounds overweight, and transforming that person to a healthier quality lifestyle, giving them a better chance to live and enjoy their family, do the things they enjoy doing. It's life. That's what we want to live the good life. That's what we talk about at Good Life Health, is we want to live the good life. So that's what our focus is in this office. Again, I hope this information has been helpful today. I know it's an exciting weekend for Christians all over the world. And, today being Good Friday, I hope you guys have a fantastic day. I know a lot of people are off today. So I hope you had time to maybe just turn on the phone and listen to some of the information we provided. Next week, we're going to get a little bit more in details on obesity and some of the issues related to that, just to educate and inform, and also that there's a solution out there. We have a phenomenal weight loss program that can truly change your life, change your health and your well-being. So we're going to focus on those things next week. But this week, again, if you have a low back issue, if you've got a friend or a family member that has a lumbar disc issue like a herniation, an extrusion, a bulge, and you're concerned about them, don't hesitate to contact our office, ask more questions. If you're concerned about spinal decompression, what is this? Go to the SebringDiscCenter.com, and take a look there. It's got a lot of great information that allows us. All right, I'm just getting a little message right here before we finish up, but we're gonna make sure we get a smoothie taste test here before we're done today, as far as the smoothie that we made earlier. And but yeah, again, go to Sebring Disc Center. Low back pain. It's got a lot of information in relationship to what we do with spinal decompression. Again, non-surgical. And if you've got a degenerated disc, bulged disc, herniated disc, bottom line is stenosis. When you've got stenosis, the changes there are going to make a tremendous difference in your life and what you can and cannot do. And we've made a lot of great changes in patients' recoveries, the ability to get back up on their feet. But I think that concludes what I'm going to share with you today as far as low back issues and what you can do for that. Also, quality of health, work on this immune system, guys. Host defense, innate immunity. That's the body's initial response to any type of mechanism that you come into that's invading the body or trying to. And we want to build a healthier body so we maintain a healthier immune system. So we're not saying vitamins and minerals and foods are going to cure COVID-19. That is not the case at all. We're telling you, start more on the offensive. Build a healthier, stronger body and give yourself a better chance. Whether you might be one of those that later on are tested and you have antibodies to the COVID-19, but you might end up being totally asymptomatic because your immune system was functioning at a level that it totally annihilated the virus, and you had no symptoms, no fever, no anything. And then there are those that do, and I'm not saying that theirs is any weaker or stronger, but no doubt the symptomatic phase, you test positive for it, and then you address it and hopefully can rebuild the immune system and get back on your feet and recovery. And I'm excited to see all the numbers of patients who are recovering from the virus. We hear so much about the negative and the fear and of course the deaths, which are very unfortunate. So, take the necessary steps, guys. Wash your hands, use soap and water, use the sanitizing to clean things up, and just be healthier. I think it's going to change what we do from here on out for the rest of my life, for our kids' lives. There's going to be a big change here moving forward, but let's take the positive on it, keep trying to reinforce what we need to do to keep a healthier body. Hope you guys have a great weekend, but let's try our smoothie. I want to try the smoothie there, our Florida blueberry smoothie. Yep.
We have a question from James. He's having a problem with his neck and wondering if there's something he can do at home. He doesn't live here in Sebring any longer.
James, what you're going to do as far as the neck goes, the number one go-to, depending upon what your condition is, if you woke up maybe with acute pain or if it was just pinched or is ongoing, I recommend number one, use some cold. Use a cold pack. Cold will reduce inflammation. It'll give you some relief. It'll give you a chance to move the neck a bit better. Of course, when you're in the shower, try some warm water, not a heating pad, but a warm shower or a hot shower. Loosen the neck muscles up. You can go through the basic yeses and the nos and the maybes, which are the general movements of the neck. So work those in the shower. We call them yes, nos, and maybes. Those are the 6 pure motions of the neck. And then use the cold pack 4 or 5 times a day to reduce the inflammation in and around the neck. That oftentimes will calm it down, get you feeling better, and then find someone that you can see and go get that addressed. Get an x-ray of it, take a look and see what may be going on there. And those are typical cases that we see every day, and we're able to help patients resolve those issues with being adjusted. So without a doubt, get it checked out further, but at least at home. There's also some analgesics you can use. Some patients will use a TENS unit, but again, you really need to find out more specifics, maybe by seeing a doctor and seeing a chiropractic physician, get an x-ray taken and see what's going on underlying. But as far as a cold pack, warm shower, those should help calm things down. You can use a topical analgesic of some kind that you've used in the past, and that can help the symptoms calm down as well. But use those cold packs 4 or 5 times a day here for the next several days there to help keep that inflammation reduced. So, and we got our smoothie. We got it right here. So guys, again, Fresh from Florida, and again, we are an educator with Fresh from Florida now. I just think as far as our weight loss program and in our office, I'm always encouraging patients to eat more fruits and veggies, and we really just got on track with the fact that, hey, you know what? Eat the Fresh from Florida. Today we had a blueberry smoothie with several different things in there. Some chia, we got some protein in here. We put half a banana in. You can put anything you want to, but again, you moms out there, work on producing a smoothie that's got Fresh from Florida fruits, even for that matter, veggies. I like the protein to balance it out between the carbs and the protein there. Balances and maintains your blood sugar so you don't have such a spike on that. But hey, here's to good health. You guys have a great day.